Anterior cervical decompression and fusion is a very commonly used or performed procedure to decompress the nerve roots and the spinal cord in the cervical spine, being the neck. When patients have arm pain or numbness or weakness or symptoms related to the spinal cord, such as gait changes or imbalance, sometimes surgery is indicated. When surgery is the right treatment and there's no other options or other options have failed, then the indication is based upon where the problem is. And that could be in one level, two levels, or many levels. Many factors are taken in consideration, such as the patient's symptoms, the MRIs, the CT scan, the expectations of the patients, as well as other factors such as alignment, previous surgeries, etc. Once we feel that the best treatment is to go in the front, after all the routine medical evaluation, patients come to the hospital, is done under general anesthesia, is done through an incision on the left, usually the neck of the left side of the neck, and we do it in a way that really leaves very little scar. Once we cut the skin, there's not much cutting inside, so it's really a very atraumatic technique where patient may suffer or may experience sore throats or difficulty swallowing, which nowadays is rare. And if it does happen, most of the time it goes away with some recommendations that we're happy to provide. Patients stay in the hospital 1 or 2 nights, depends on the number of levels. They're given a brace for a week for comfort. And then after 2 weeks, they could swim, they can do stationary bike, and they're totally independent, including driving at 2 weeks. By 2 months, which is what it takes for the bone to fully heal, we usually recommend them to go back to normal life, or sometimes a short course of therapy is recommended. Patients are told to resume all activities by 4 months. And even before that, they can resume sports. After surgery, patients are encouraged to call us with any questions or concerns, and we're happy to see them anytime, although most patients come at 4 and 8 weeks for follow-up. If you have any questions or concerns, please feel free to call us at any time for any questions or concerns.